thank you for your presence here today, for your continued commitment and support to the Defeat-NCD partnership. This year, our session is focused on action, on commitments realized, on guidance applied, on words being translated into action. We have a rich program for today, starting with a keynote address by one of the earliest supporters and thought leaders who has been guiding and supporting the Defeat-NCD partnership since its inception, really, and making sure that its strategy and focus is on practical action complementary to the norms and standards of the World Health Organization. Ladies and gentlemen, Dr. Tedros.
The Sustainable Development Goals set a target of reducing premature deaths from NCDs by 1/3 by 2030. But on current trends, we will not reach that target. That's why we have called this session From Words to Action. It's time to step up. Far too many people around the world lack access to these life-saving medicines and interventions, especially in the lowest income countries. Today, we're discussing several efforts to address these severe inequities. One important contribution is the Defeat-NCD Partnership's Essential Supplies and Distribution Facility, which aims to improve the availability and affordability of medicines, diagnostics, and devices. The partnership has also supported countries, including Rwanda and Gambia, to develop, fund, and implement national costed action plans, and together with WHO to support young researchers. Like any other area of health, research is essential if we are to make progress. That's why in WHO, we have established a WHO Technical Advisory Group on NCDs innovation and research, which will focus on implementation research and on building capacity in research. Investing in the next generation of public health leaders and researchers in lower income countries will help close the knowledge to action gap and improve the uptake of proven NCD interventions. That's why WHO, the Defeat-NCDs partnership, and the Alliance of Health Policy and Systems Research have launched an NCD implementation research grant program for younger researchers from low and lower middle income countries. Today, we're pleased to present 8 finalists whose research effort will make a difference. Please join me in congratulating these young leaders. And before I close, I would like to thank Mukul, my friend, for his leadership.
As the world embraced the prospect of a life without COVID, I should say, for a very large swathe of the global population, non-communicable diseases continue to exact a chilling toll. And there is so much to consider, including, of course, the rising cost of medicines, the presence of substandard drugs in supply chains, a lack of regulatory harmonization, and the challenge of ensuring that medicines are not only available, but are also used appropriately.
We know that if we are going to achieve the SDG 3.4, 3.8, but also the triple billion that is set out by WHO, we need to act now. We know we will not be able to achieve SDGs without including NCD to UHC, but it's also that we will not be able to be prepared for any new pandemic or any humanitarian crisis if we do the same. So no UHC without NCD, no preparedness and health security without NCD into UHC.
I'm so pleased to be with you here, and I'm proud of what the Defeat-NCD partnership has achieved on the last few years, especially part of it was during COVID. So we're very glad that with the very urgent, important thing of COVID, we didn't stop these other important things and vital like NCDs. So it's clear that if we could protect more NCDs, we can protect even more deaths from COVID. Through this year, this decade, we learned a lot of things, and we can speak, but we need to take actions too. And this will not happen through partnerships and synergism between different partners. Qatar internationally is keen to be part of the world and add value internationally. Qatar has been working with 78 countries, supporting many countries, and trying to take responsibility for SDGs on these countries. We are hoping by this, Qatar is a hub. We can go to more than 250 destinations from Qatar. We're hoping that we are proud that working with the Defeat-NCD to have an office, and we are hoping this relation to have a chance to support these countries and to close the gap that's happening for NCD that was delayed even more during COVID. We are hoping through this relation and partnership to find more innovative ways and to prove to the world that we are making more efficient and effective ways that it's worthy to invest in.
To ensure that our experience in India and that our huge production capacities are serving the global good, India can serve as the true pharmacy of the world. India is working closely with the Defeat-NCD partnership. We have signed a partnership agreement that serves the various states in India to scale up their response to NCDs, but also bring India's expertise to other developing countries and ensure their continued access to quality assured, affordable NCD medicine and supplies through the essential NCD suppliers facility. For implementing our newly established national vaccination program for HPV vaccine in India, our drugs controller has given approval recently to Surveyvac, which is India's first HPV vaccine. Hopefully, it would be affordable and accessible to our prepubertal girls 9 to 14 age group.
It's such a pleasure to be here and exchange ideas on how to tackle some of those health challenges that we face that are, well, staggering numbers. We all heard those numbers. We heard how also collaboration is so key. And now I would like also to show how innovation and rapid integration of innovation into the healthcare system can also help and is part of the solution, because collaboration and innovation work hand in hand. I'm also very proud of the work we are doing through our health through collaboration approach, and Mukul, I share your passion around the progress made with the NCD partnership. We have been a contributing member to this partnership since 2019, and we already see those concrete results, especially in our case in Gambia, Ecuador, and Rwanda. And I'm really happy and pleased to announce that we will be extending that partnership for another 3 years, and hopefully in more countries. Science and technology cannot solve all the challenge on its own around NCDs. It is collaboration between businesses, researchers, regulators, policymakers, payers, decision makers, you name it, all of us in this room, that we can make a real impact on health systems and people. After all, we all want the same thing. Together, we can fulfill the aim to deliver a better health for all. And our purpose to benefit every person in need, regardless of where they were born or live, transforming lives for generations to come.
I'm so happy to be here in support of the Defeat-NCD's partnership event. At Helmsley, when we're looking at new investments, I like to start by picturing the people on the receiving end of these programs. I think about the mother I once met in Malawi, whose daughter was diagnosed with type 1 diabetes. For the mother in Malawi, the essential supplies facility could have made the difference for her life, for her child's life or death. From Helmsley's perspective, we are excited that this model cannot only ensure life-saving insulin, can also provide so many other medicines for life-threatening NCDs. In global health, partnerships are absolutely critical for making a sustainable impact. The facility promises to break down the silos with a single procurement system rather than a patchwork of supply chains. And at Helmsley, we look for investments that strengthen systems that improve the lives of people in communities and in countries. And this facility approach has the potential to transform the ecosystem of care for everyone living with NCDs. So I want to congratulate the Defeat-NCD's team on this work. Helmsley has been a proud support from the beginning. We hope that model will inspire procurement partnerships around the world. I know that I will do everything in our power to strengthen health systems, to support the universal health coverage, and to support efforts like the Defeat-NCDs and the essential supplies facility to ensure that every drug for NCDs is available to every corner, to every household that they need it.
We have an immense vault of scientific knowledge that we can harness to address the multiple public health crises before us. And yet, somehow, we are not there yet. There is a considerable gap between what we know needs to be done, what we can do, and what we have achieved. This is where implementation science steps in.
It's a big partnership, and I am, as a director of the Global NCD platform, want to highlight that we have the very good partnership with UN agencies, with Defeat-NCDs, and with others who are also participating in this World Health Summit. And it's really a good history, a good example of collaboration where we are engaged with our colleagues and we support the researchers, and the young researchers is the priority. As it was mentioned in the DG's speech, we are really looking for the investment of the young people and their contribution of preventing the non-communicable diseases.
One phrase that has not been mentioned in this room today is the threat of climate change that hangs over our world. Why is that significant to NCDs? Because the global heating, the floods like we've just seen in Pakistan and New York and lots of other places, the storms like we have in the Caribbean that smash everything, the sea level rises, these things, people with NCDs are particularly vulnerable. And so I encourage the Defeat-NCD partnership to take consideration of that change in its planning, its pillar one, in thinking of how you innovatively deliver services, in thinking of the essential medicine supply. We've seen in the Caribbean where after a big storm, excess mortality, mostly due to NCDs, goes up for months afterwards. And that's because people can't get their insulin, they can't get their renal dialysis, they can't get a whole lot of other things that they need access to. So how to cater for that in future is the first challenge. The second is we need the partnership to grow, to address the existing problem and to deal with the superimposed challenge of things like climate, like biodiversity loss, like pollution. We need more partners to join it, and I encourage those who may be listening to think of that. And then the very last thing I'd like to say going forward is to thank and recognize the CEO and the staff of the Defeat-NCD partnership. They've been doing a great job.